patients with serious mental illness are treated here at the Capital District Psychiatric Center, just one of the facilities run by the State Office of Mental Health, also known as OMH. The agency regulates, certifies, and oversees 4,500 programs across New York, from suicide prevention to counseling. But as News Channel 13 learned, the employees that get all that done rack up a lot of overtime.
Records we obtained show that overtime at OMH spiked nearly $8 million in 2 years, topping $82 million. Some of the employees making more than twice their base salary.
Just look at what a secure care treatment aide at a Bronx OMH facility pulled down in overtime last year, nearly $116,000. That's 240% over his base salary of $48,000. Here in the Capital Region, a mental health therapy aide earned $88,000 in overtime on top of her annual salary of $43,000. And a psychiatric nurse earned nearly $80,000 in overtime over her base pay of nearly $56,000.
They're totally not acceptable. Out of control overtime evidently is still a problem within state agencies in the state of New York, and I think we need to do something about it.
Senator Jeff Klein chairs a task force on government efficiency and says there's not enough oversight at state agencies like OMH to make sure overtime is justified.
I think we have to use overtime as a performance indicator to reward managers or punish managers whose agencies have very high overtime.
So what explanation does OMH have for overtime expenses that have soared more than 14% over 2 years? Commissioner Michael Hogan's office wouldn't answer our questions, but the union that represents many of the nurses says overtime is caused by a drastic staff shortage.
People are working shifts that are just basically wearing them out, and that they are doing the work of 2 and 3 people.
Susan Kent, the president of the Public Employees Federation, says nurses aren't trying to boost their pay by taking overtime shifts, but instead just scrambling to cover the required care.
Anyone that has a loved one in an OMH facility wants to make sure that their loved one is being taken care of. If there's not a nurse there, I don't think that they would want the result that would happen.